I'll be focusing on gonorrhea. Gonorrhea is passed by the pathogen Neisseria gonorrhoeae. It's one of the most common STDs, and it's found most in young people ages 15 to 24. The highest amount of cases reported in the U.S. were between 1974 and 1985. Since then, gonorrhea has been on a steep decline until 2018, so a little more recently, which has reported a slight increase compared to the years prior. Since 2012, more men in the U.S. have been diagnosed with gonorrhea compared to women, and that is on a slight increase. The states that most commonly reported cases of gonorrhea were southern states and states along the eastern coast. Some of the fewest states that reported cases of gonorrhea were in Utah, Idaho, and Wyoming. This pathogen is spread through anal, oral, and vaginal sex. In other words, it can be contracted by anyone who is sexually active. It causes infections on the genitals, rectum, and in the throat. In pregnant mothers, gonorrhea can be contracted through delivery. The baby can actually receive it by coming out of the birth canal if the mother has vaginal gonorrhea. Common signs are different for men and women. For men, common signs are a burning feeling while urinating. White, yellow, and also greenish discharge from the penis are a sign of gonorrhea. If rectal gonorrhea is contracted, symptoms might include discharge, anal itching, soreness, bleeding, and painful bowel movements. For women, some common signs are also the burning and itching feeling in the vagina while urinating, and increased vaginal discharge and vaginal bleeding in between periods. In men, this STD, if gone untreated, can cause pain and discomfort in the testicles and genitals, while also causing the man to be sterile. In women, it can cause infertility, scarring, which can block the fallopian tubes, and ectopic pregnancies, which is where the baby is born on the outside of the womb. In most cases, the doctor can use a urine sample to diagnose gonorrhea, but if anal or oral sex is a part of where you got the gonorrhea, then swabs of the rectum or the throat can be taken to obtain a diagnosis. For both men or women, if the disease is gone untreated, there can be lasting damages. In severe cases, gonorrhea can spread to your blood and joints, becoming life-threatening. Also, having gonorrhea increases your chances of receiving and giving HIVs. Gonorrhea is luckily treatable, though, and it's most commonly treated by medications. However, some strands are becoming harder to treat due to drug resistance. For the best way to prevent contracting gonorrhea is by first asking your partner if they've been tested, just so you know that they don't have it. But also wearing protection such as condoms during sex are a great way of protecting it, or protecting yourself from getting it. And depending on your sexual activity, if you have multiple sexual partners, it's recommended that you be tested annually. However, if you have just one sexual partner and you know that neither of you have it, then you're probably safe.